Hi, doctor.
Hello, my name is Dr. Mario Cuellar, and I'm a prosthodontist in the city of Monterrey, Mexico. We're specialized in all kinds of treatments for fixed prosthodontics, removable prosthodontics, aesthetic rehabilitation, and implant restoration.
For patients who are interested in medical tourism or thinking of traveling to Monterrey to get a procedure done, I'm going to ask you a couple of questions that I think they're going to be very helpful for those patients. If I'm planning a virtual consultation with you guys, do I need scans or labs before that?
Yeah. If you want to get the most of your consultation, you need to give us the more information you have. So if we have CT scans, if we have x-rays, even if we have clinical photographs, those are going to help a lot for us to give you the best options we can, because we're in a distance. Normally, we need to check the function of your mouth, and when we don't have that kind of access, CT scans and all that information is going to help to give you the information that you need. And the other thing is that this information also is going to help us to give you the best estimated on prices. A lot of time I see that patients want to know how much is going to be this if I put this bridge over 2 implants. Okay, well, if we have the CT scan, we can have more information if you need a bone graft, for example, or if you need this type of abutment or this type of material, and then we can give you the estimated more accurately than just telling you, well, you need this and this is the price. So if you have CT scans and x-rays, that's going to give you much more information, and the consultation is going to be more productive for you.
It makes total sense. So if you guys have all the information, all my medical records, you guys are going to be able to plan ahead what I need, what procedure and stuff. And with that, you're going to be able to give me an estimate that's going to be more realistic to what it's going to be done to me. That's what I'm getting, right?
Yes.
And if I'm traveling or I'm visiting from other country or the United States, and I'm going to have, let's say, removable dentures, how many visits do I need to do to Monterrey to get the whole treatment done so I can plan ahead?
If we're talking about a removable prosthesis, it depends on the time you can assign for your trip. If you tell me, for example, I can be in Monterrey for 10 days, maybe in 10 days I can deliver a removable prosthesis. How many visits? Maybe around 3 visits. First one, we do the initial checkup, and then on the second one, we do final impressions, and the third, we're going to do a try-in, but maybe we can deliver on the third appointment. And this can be on a lapse of 10 days. If we're talking about a prosthesis and we're talking about an implant prosthesis, it's different, because maybe in a week we can do all the planning, the initial part, and the implant surgery. Maybe on 3-4 days we can deliver that, but we have to wait to finish the second part of the treatment. So that's going to take another visit to Monterrey, maybe in 3 months, 4 months, depending on what we are doing on the initial treatment plan.
If it's a removable dentures, I can do it like in 7-10 days. My whole removable denture is going to be on point. And if I go with a fixed denture, like for dental implants, I need a couple of days first to do the whole planning and then the first step, and then come back like in 4, 3, 6 months tops for the rest of the procedure, right?
And we have another option. If you need fixed prosthesis over the teeth, we can deliver that very quickly. We can, maybe in 4 or 5 days, we can deliver a fixed prosthesis.
So if I'm getting dental implants, then I will need basically 2 visits. One of approximately 7 days, and then another one a couple of months later. If I'm using my regular teeth, you're not going to put implants. You're going to use my regular teeth, like for a dental bridge or whatever the procedure may be. That could be like in a week.
Yeah.
So if I do with the dental implants and I have to go for like 6 months and then come back, am I going to be without teeth? Am I going to have any difficult eating or?
No, normally we can deliver transitional prosthesis. If we're talking about a removable, we can put provisionals over teeth. There are several options we can take, but normally we deliver something for the patient to be in comfort.
Okay, so leave the jawbreakers at home and stay away from them for a while. Okay, thank you very much, doctor, for your input on planning a medical tourism trip for dental implants or dental prosthetics or removable or fixed or whatever you're thinking. Dr. Mario is in Monterrey, and we're going to provide his contact info on the text of the podcast. Thank you for listening. Thank you, doctor.